Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Altman Health Systems. Today, Brad and I are broadcasting from our administrative office, and we will be discussing Medicine Center's new Health Matters membership savings program. We would also like to remind our listeners that today's program is also available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. Good morning, Brett.
Good morning.
So, what is the Health Matters membership savings program?
Well, this is a program that we developed listening to what our patients have really asked for. And, it's been kind of an interesting journey over the last couple of years. Many patients who have an employer have had discussions with them about being mindful of your healthcare expenses. And that could be anything from your prescription drugs. It could even be your lab tests. It could be procedures that are performed at different facilities. I feel like we're getting a lot of education from our insurance companies and our insurance brokers lately about being more informed about the decisions you make about your healthcare. And as a result, trying to choose wisely how you spend your healthcare dollars. And I think we have a situation in our country where we've had health insurance for decades and we all expect it to pay for everything, and we don't feel like we should really pay for anything out of pocket. But I challenge you to think about a different type of insurance, and I challenge you to think about car insurance. And when you insure your car, you have a situation where insurance covers the catastrophic things. You have an accident, God forbid, or you have some type of situation where maybe something goes wrong on the car or it's stolen. But if you need an oil change, you pay for it. If you need new brakes, you pay for it. If you need new tires, you pay for it. So the general maintenance of the vehicle isn't covered by your insurance. And I think what's happened in our economy is that the insurance companies have kind of applied that to healthcare in a way that many of us didn't really discover up front. So I think that insurance companies are starting to look at prescription medications specifically as more of a maintenance of your health rather than a direct result of your insurance coverage. And that is where the Health Matters membership savings program was born. Last year, we developed a list of about 115, 120 medications where we offered them generically to patients at a 90-day supply at a very affordable price. But people wanted more. And they're like, it doesn't cover everything. And they wanted another advantage. So the Health Matters Savings Program is something that we just launched. It's been kind of in the works here for the last month. We've been educating our patients and getting some great feedback. And we're looking forward to giving you the details and sharing with you this morning what it's all about.
Okay, so what is a cost plus drug savings plan?
There's been a lot of buzz in the industry, and a cost plus model is probably most accurately mirrored by Mark Cuban. And he wasn't the first person to market the cost plus model, but he is probably the most famous given his background on Shark Tank and his ownership in the Dallas Mavericks. And he's an entrepreneur of sorts. And he's made it his mission to try to apply affordable medications for everyone. So basically what we've done is kind of taken the model that he is using, which a cost plus model is a model where basically you pay the cost of the medication plus a small administrative fee. And we'll talk here in a little bit about how that works, but it is a very transparent model. And we're going to talk about how insurance company PBMs kind of skew that here in a little bit. But a cost plus model is basically giving you better transparency. It's giving you a more clear picture of what you're paying for your medication. And in the long run, it's going to save you quite a bit of money.
So, how does a cost plus plan differ from other prescription membership programs?
That's a really good question because there are a lot of programs. You can't turn on the TV or the radio and not hear ads for GoodRx or Single Care or ABC discount card. And the difference between a cost plus plan like our Health Matters membership program versus a GoodRx or Single Care is for one, our plan covers every generic medication we have. The other thing is on like a GoodRx or Single Care, there's not a lot of transparency. And what I mean is if you go to their website and look at their prices, they give you a different price for medications at every pharmacy, which I've never really understood. And some medications you save more than others. It's kind of one of those things that I've always felt it's confusing. And I can tell you what a big difference is too is our friends at GoodRx recently got themselves in trouble with the Federal Trade Commission for selling patient information without informing the patient. So there's an issue with privacy and transparency on your own private data there. So I think that's kind of scary. The other thing about membership programs like GoodRx or Single Care is they take an enormous fee from you, the patient, and also the pharmacy. So the reality is you could look at our Health Matters membership savings program and you're not going to pay all those extra fees. So it should save you money on top of what is promised by one of these national companies, because you know what? They spend a ton of money on TV advertising and radio advertising. And where do you think that money comes from? It comes from the fees they charge you.
So, how does a cost plus plan offer transparency in medication costs?
So the cost plus model, which we have formulated the Health Matters membership program off of, basically takes the cost that we buy the drug at, and then it applies a administrative fee. So if you think of things like, when you get your prescription filled, many people get them in a bottle. So it includes the cost of the bottle and the label and the bag and the cap and some labor cost. So it doesn't include a bunch of spreads. I mentioned at the beginning of the show that a lot of prescription drugs right now in the country, almost 85% are priced by a PBM, which is a pharmacy benefit manager. And the pharmacy benefit manager is a middleman, and their job is allegedly to keep drug prices low. Well, the ironic thing is over the last decade, they haven't kept prices low. They just keep going up. And one of the things that they do is they charge a spread price. So they might charge you, the patient, a $10 copay for a drug, but they're billing your employer $200 for the drug, and they only pay the pharmacy $25 for the drug, and they keep everything in the middle. So it's a model that's kind of very cloudy and has a very muddy bottom of the lake, if you will, and you never truly see what the true price is that you are paying or your employer is paying for the medication. So the cost plus model eliminates all that. We basically we sell you the medication on our membership plan at our cost plus a small dispensing fee, and that covers our labor and the bottle and the product that you get when you pick up at the pharmacy.
So, can you explain how the fixed fee or percentage is determined in a cost plus plan?
Yeah, we just look at the overhead. So, if you think about a pharmacy like ours at the medicine center, we have a building to maintain. We have heat, light, and air. We have our staff that we take care of with their wages and insurance, and then we have the supplies we use in your prescriptions. So basically, we take all of those expenses and we divide it by the number of prescriptions we fill in a given year, and we assign that value to each prescription. So what we do is basically, in our cost model, is we just look at that expense and we apply it to the cost of the medication. So instead of having that strange spread pricing thing, which never really made sense to me from the PBM model, we cut out that middleman. So those expenses are gone. You don't have to worry about prior authorizations from your doctor. You don't have to worry about the insurance company telling you or your doctor that you can't have a certain medication because it's not on the formulary. With the cost plus model, it's all the generic medications we can have access to at our cost, plus a small dispensing fee to cover the overhead that gets dispensed when you pick up the prescription at the counter.
Okay. Gosh. So, what is a potential cost savings for patients with the Health Matters membership savings plan?
This is a really good question because it's kind of variable, but I really feel that it's worth every patient looking for. And as we've been talking with patients and our staff team members, basically, if you have a generic medication, I would focus on those. And if you pay a copay over $10 or $15 for your generic medication, there's a high probability that you could save some money with our membership program. Um, Basically, it's a situation where it's kind of medication dependent. There are some medications where patients can benefit more than others, and there are some insurance plans that can benefit more than others. So, for example, if you are a patient that has what we call a high deductible plan, and high deductible plans are plans that usually have copays of $3, $4, $5,000 out of pocket before coverage kind of kicks in. Your employer has probably talked to you about making sure that you use your healthcare dollar responsibly. Hopefully, you're healthy enough that you'll never spend $3,000 or $4,000 out of pocket for your healthcare a year. But the reality is if you get a couple prescriptions, you want to make sure you buy them at the best price you can. And maybe you've looked at a GoodRx, or maybe you've looked at a Single Care, or maybe you've called the pharmacy for a price quote, or maybe you've just run the prescription through on your insurance card and it comes back at if you look at it, you end up paying the full price of the insurance, if you will. So you don't really get any coverage. So we've had a couple examples in the last week that have been pretty staggering. We have one patient that takes a medication called pregabalin, and they get 90 tablets at the pharmacy for a 1 month supply, and they were charged for 100 milligram pregabalin $157 by their insurance company. If they got the prescription on our membership program, it would have been less than $20. So that patient paid, that patient could have paid almost $125 more than they should have if they would have used their insurance. So that's an extreme example. But the cool thing is that we're finding that patients can actually save money, even if they only get 1 or 2 prescriptions. And what we can do after we come back from our commercial break is we'll talk about how we can help them figure out if they have an advantage on our membership program.
Wow. Okay, Brad, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you tired of paying hundreds of dollars to find out your thyroid, A1C, cholesterol, and vitamin levels? You don't have to anymore. Schedule your low-cost lab test at the Medicine Center Pharmacy. You can get your A1C, thyroid, and vitamin D lipid profile, which includes your cholesterol levels as well as glucose results. Test results in just minutes, and you can share them with your provider. Call the pharmacy or schedule online at MedShopRx.com. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. If you haven't been in the Half Off and Out by store in Louisville lately, you won't believe the merchandise. A huge craft buyout of all kinds of artists' paints, acrylic, and more, all at better than a half-off price. Additional 20% off all winter clothing, boots, hats, gloves, scarves. A new shipment of all kinds of cleaning supplies, the usual and the unusual, plus a lot of Valentine's Day and Easter decor, gifts, etc. Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to the pharmacist about our Health Matters membership savings program. We want to help you stay well and save money. So what are the benefits of the Health Matters membership savings plan for patients, Brad?
We have quite a few benefits. And you know, first off, it's just sheer cost the patients will spend for a prescription. So for example, you know, before the break, we talked about one extreme example that saved somebody $125 and change. You know, some other very common medications, you know, I brought up a list of one patient we looked at our Louisville store, actually. And I'm not going to certainly divulge their name for privacy's sake, but I will tell you that, you know, they take 9 different medications. And 7 of their medications out of the 9, we actually had a better price on our membership program than if they would have used their insurance. So for example, some common drugs you may have heard of. Those are, the first one is lisinopril 20 milligram. It's a very common medication patients with high blood pressure or even diabetes use. The patient's copay was $22.50. The price on our membership program is $8.07. So that patient could have saved significantly $14.43 just on that one prescription alone. They also got amlodipine, which is another medication for blood pressure. Guess what? It was $22.50 also. Our membership price is $6.67. Pravastatin, a popular cholesterol medication, $22.50 again for a 90-day supply on their insurance, but our membership price was $13.14. All told, when you look down at this patient's medications, our membership program could have saved this patient $83 a month. And our membership program prices start at just $5 a month. So for $5, this patient could have had an enormous return on his investment. And as a result of getting these prescriptions, you know, this patient gets a lot of prescriptions on a 90-day supply. But if they're going to save almost $90 every 90 days, that'll buy a lot of groceries. So this is something that I feel like patients really need to think about. You have to understand that your insurance price isn't always the best price. And, you know, interestingly enough, even the sponsor of our program, Altman Health Foundation, patients that have Alt Care, they're actively encouraging patients to shop around for better prescription prices. They have an app where if you would buy a medication on our membership program and you choose to purchase that lisinopril for $8.07, you would actually be able to take a picture of your receipt and upload it to their website, and that would be applied towards your deductible. So that's one of the things that we haven't talked about yet. But, you know, if you have insurance and you're trying to meet a deductible, you're going to have to talk to your insurance plan or make a decision, because if you used our membership program, it may or may not apply to your deductible unless your insurance company has a vehicle to apply your out-of-pocket expenses. But for example, Alt Care, one of the biggest insurers in the community, they have a process for that. And they're recognizing that patients are being more frugal with their medication spend, and they're trying to encourage them to help them control medication costs for patients.
Okay, so what factors should patients consider when deciding if the membership plan is right for them?
Okay, well, there's a couple things, and we've kind of taken the membership program in a couple different directions based on what our patients are looking for. So we have patients that come in every day and have their insurance and they're happy with it. No problem. We have patients that come in and ask us quite a bit about how can I get the best price? So if you're just looking for the best price and no frills, the basic membership program is the perfect solution for you. It is basically on average $5 a month. It's, you know, it's $18 a quarter or $60 annually. It's one of those things that if you buy it on an annual basis, it's a lot cheaper. So we try to reward you in that fashion to save even more money. But you basically would get, with our basic membership program, you'd get the best price. So you'd get the best price on every generic we have. If we don't have that generic in stock, we can check with all our suppliers and try to source it for you and provide that medication for you at our cost plus our dispensing fee model to save you money. You can take advantage of our drive-up windows. You can walk in the pharmacy and pick it up. Simple, no frills. The next level is we have a lot of patients that really enjoy home delivery. Maybe they have ambulation issues, or they can't get out, or they just feel more confident if they're not out in the roads dodging all the crazy traffic. So we have another tier of membership program where if you decide you need free delivery or home delivery, we can offer you a free home delivery once a month. And we can also offer you some services in addition on that membership tier, where if you are interested in our easy dose packaging, where we package medications in a strip pack for you, we can provide that service with our second tier. So we have two membership tiers. The basic tier gets you the best price, and the advanced tier or the plus tier gets you a free home delivery once a month, and also the option to have your medications packaged in a strip adherence packaging to help it make it more convenient for you to take your medication. And that runs on average $36 a quarter or $120 a year. So the reality is you can pick the best of what you need. Do you need home delivery? We've got a tier for that. Do you just want the best price? We have a tier for that.
So, are there any limitations or restrictions on the types of medications covered under the Health Matters Membership Savings Plan?
There aren't many. You have to have a prescription from your doctor. We do have to abide by Ohio laws and rules. So, there are some limitations based on what we're allowed to do based on Ohio law. But, basically, if we can find you a generic medication for your medication, we can help you. There are some medications that aren't available generically. So those medications are the medications that you see when the TV's turned on and you've got all these beautiful ads with all these drugs that you can't pronounce, for example. So there's a lot of medications that are brand name medications that we don't have a solution for yet. They're extremely expensive, and even on a cost plus model, it's not going to make an enormous benefit for a patient. So we're looking to try to find solutions for that. But right now, a generic medication is 89% of all the medications that we dispense in a given day. So you have an 89% potential to save money based on what most people use. The other thing is I mentioned earlier about your insurance. So with your insurance program, you need to make sure you're aware of where you're at. If you're a pretty healthy person and you only take one or two medications and you have a high deductible plan, maybe you have no hope unless you have something awful, unexpected happen that you're going to meet that $5,000 deductible. And you don't mind if your $8.07 lisinopril doesn't go toward your deductible. So that's something you'll need to decide. And the other thing is I guess you need to decide if how you would want to approach it. Our staff can help you navigate. It's one of those things where if you just want the best price, our basic membership's the best program for you. If you want to have some other services like home delivery or some special packaging for your medications, then our plus membership would be best for you in that regard.
So, I don't know if we handled this before or not. Can you provide examples of how patients have saved money with Health Matters Membership Savings Plan?
I can, but I think we better take our news break, and we can do that right after the break.
Okay. All righty. It's time for our second break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy, friends. Just a reminder to stop by the pharmacy and talk to a pharmacist about our Health Matters Membership Savings Program. We want to help you stay well and save money. So I asked you a question before the break. Can you provide?
Yeah, so
you got it?
yeah, I got it. Yeah.
Okay.
Okay. So you wanted me to provide some more examples of how patients can save money with the Health Matters Savings Program. And, I think that, the deeper we get into this, the more amazed I am at how much patients are paying for prescriptions. I know that there's a lot of stress on the dollar now, given how expensive everything is. So here's just a couple examples. We had a patient in with a cold yesterday in the Canton location, and they got a prescription called benzonatate. It's 100 milligrams. It's for cough. So if you have a cough, this is a common little gel cap. It's like clear and it dances all over the counter if you drop it, and they're kind of squirrely to count and pick up because they're an odd shape. But anyway, benzonatate, 100 milligram. Their insurance was going to charge them for $54.47. And that was the full price on the medication. The insurance wasn't paying a penny. So we ran it on our membership program formula, $8.63. So, I can't stress enough for patients to ask questions. I mean, in the pharmacy, we're very accessible. You don't have to call and make an appointment to talk to us. You don't have to, you're welcome to talk to your doctor. We're working very diligently to try to provide education to patients and providers and local employers about our program so that they can understand that there's a local solution for you where we cut out middlemen and we can help you get the best generic price. A couple other examples. A different person we had yesterday in the New Philadelphia location, they're a diabetes patient, and they take metformin, 500 milligram, and they were going to get 90. And that was going to last them. It was going to last them almost a month. Their doctor was kind of playing with their dose.
Wow.
But their copay was going to be $22.50 on their insurance. Insurance wasn't paying anything. Maybe they're in the deductible period, maybe they're not. But our Health Matters membership program price is $7.31. So, it would have saved them $15.19.
Wow.
So, when you start looking at just our basic membership program, on average costing, if you do $18 a quarter, even if you do $18 a quarter, it averages $6 a month. One prescription for that patient, and they took 5, but one prescription paid for almost the whole quarter for the membership access price. So it's one of those things where this particular patient and the meds they took overall, it saved them $35 for the month. And that money can go a long way for patients. So there's a lot of different ways to look at it. I just feel like the best thing we can do is to provide education to the community and help you find the best price. And, it's always a dog and pony show in healthcare. There's a lot of ads on TV. There's a lot of ads on the radio. Maybe you're looking at this program we're doing today as an ad, but you know what? My father didn't start the pharmacy 47 years ago to be a dog and pony show. We've been here in the community. We're time tested. So let's talk about this, okay? Come in and talk to one of our pharmacists. You can go to our website at medshoprx.com. It's medshoprx.com. You can click on the price checker right on the website, and you can plug in the drug that you take. You don't have to, be embarrassed to come in and ask us what the drug price is. If you want to do it in the privacy of your own home or on your phone, you can do it right there. It's easy. If you punch in a drug name and it doesn't come up, give us a call. Maybe it's an item that at the moment we don't have in stock, but that doesn't mean we can't find it for you. So ask questions about your drug prices and expect more from your pharmacy.
Okay, Brad, how about additional services or benefits included in the Health Matters membership savings plan?
So we have 2 tiers in the membership savings program. If you're looking for bargain basement best price, that's our basic plan. And you can pick up the medication at our drive up or curbside or at the pharmacy. If you would like to take advantage of home delivery, we have our Plus program, and you could get a free home delivery once a month. And you could also get adherence packaging is the fancy term we use, but we can do strip packaging for you. And basically what these do for radio listeners, we can put your medications in a little individual baggie based on the time and date you take the medication each day. So if you take 3 medications at 8 a.m., we can put all 3 medications in this little baggie. If you take 2 at lunch, we can put the 2 with a noon timestamp on the baggie for you. And if you're going to go out to dinner with friends and you need to take a couple medications at dinner, you can just tear off that little baggie and take it with you rather than worrying about a pill box or taking bottles with you and putting it in your bag or something. And it makes it very convenient for you to realize that when your doses are due, and to make sure that if you missed a dose, you can readily identify when that dose you were supposed to take. And you can always call us at the pharmacy if you're not sure what to do if you missed taking a dose of something. But we have some other services at the pharmacy that are available too. And we kind of have an a la carte situation, so if you're whether you're a member of a program or not, you have access to home delivery. We charge $5 for a home delivery right now. You could get, you can also get easy dose packaging if you're not a member of one of our programs. Everyone has access to that. We charge a $5 fee to package our easy dose packs right now. We've got some other things. We've had some patients that have been a little frustrated with their insurance plans outside of Ohio that are run by a big company in Texas. And they force patients to go to other pharmacies in the area, and they aren't able to come to us anymore. And those patients still want to talk to our pharmacist and get counseling and get guidance on their medication. And we totally have a solution for that too. So we have a way that we could schedule appointments with patients. And for a small fee, you're welcome to talk to our pharmacist about any of your medication questions or problems you have, even if you're not a patient that we can fill your prescription for. So we're trying to do different things at the pharmacy for you. I guess I'd be remiss if I didn't miss, in the spirit of controlling your healthcare costs, our point of care tests. One of the more popular things we've been doing in the last, 5 or 6 years or longer is we have lipid panels or cholesterol testing. We do glucose testing. We can do thyroid TSH. We can do vitamin D tests. All these tests we can do in the pharmacy and give you results in a timely fashion. It's very affordable. Every test that we offer is somewhere between $35 and $60, so it can save you money over going to the lab. And then we can provide the results to you and your physician if you need them for a checkup. So that's also a service that we offer locally. But that's just a couple of the things.
Okay. How does the Health Matters Membership Savings Plan support medication adherence and medication management? We know people have questions.
Yeah, I can't tell you how many times we hear a patient say that, well, this medication's really expensive. I take one every other day because I can't afford to buy enough to take every day because of how much it costs. Or maybe a patient takes 2 or 3 medications and it just gets overwhelming. I mean, sometimes if you take 2 or 3 medications and you have to take each one of those twice or 3 times a day, it gets to be a lot to manage. So the membership program can, one, help patients find the most affordable solution. And I guess I didn't mention yet, and we really should touch on it. If you have a medication that's really expensive and it's difficult for you to afford, even with your insurance, give us a call at the pharmacy. There's a chance that we could look at your medication and your situation and talk to your prescriber and help you find a generic alternative in a similar drug class, which could be much more affordable. So that's one way. If you're struggling with making sure that you don't miss doses, or you have trouble because you might forget doses because your medication schedule's challenging, we can do something simple like the easy dose packs and put them in the strip pack for you so that you can have that little baggie with the time stamp and the date stamp of when to take your medication as that helpful reminder. We also have our Medicine Center Pharmacy app where you can manage your medications, but it has a medication pill reminder. So if you want to set a little alarm in there to remember to take your medication at 8 p.m., it'll pop up and, give you an audible alert and give you a pop-up. So it gives you another way to remind you. So there's a couple different ways that we can help you with that.
Okay. So what resources are available to help patients navigate the Health Matters Membership Savings Plan?
We have several. The easiest solution, probably depending on your comfort level, is you can either stop in at our pharmacies in Canton, Louisville, Minerva, or New Philadelphia, or you can give us a call and one of our staff members would be happy to give you some guidance over the phone. We can do price checks. And you can also, at the convenience of your own home, you can go to our website and you can go to medshoprx.com and you can click on the price checker or start saving now, and it'll give you more information about the membership program, what's included, and how it works. And you can see prices on thousands of different medications. It's updated about once a week. So, if we're lucky enough this week to buy a medication better than we bought it last week, guess what? Your price could go down. So it's one of those things that we're striving to continually find better pricing and better solutions for patients because it helps us be more part of the community and more valued in the community. So if we can help you save money and remember to take your medication, the hope is that you will feel better, be healthier, and you'll avoid costly hospital stays or other chronic complications.
Okay, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Pharmacist Brad White, and I thank you for joining us. Let's get back to the last segment of the show. So, are there any specific considerations for patients with complex medical conditions or multiple prescriptions when using the Health Matters membership savings plan?
There are. I think it's, if the patient has multiple medications, they have the potential to save even more on the membership savings program. We've had a couple patients that take between 5 and 7 medications. And generally, in the beginning of the program, I mentioned that almost 90% of the prescriptions we dispense are generic. So there's a high potential for patients to save. If patients have a complex medical condition, maybe it's a prostate condition, maybe it's multiple sclerosis, maybe it's a different type of cancers. There are now generics available for common treatment options for these medications that have become extremely affordable in our membership model. There's an example that I was told by a patient about a month ago. They get a drug called dalfampridine, which is for multiple sclerosis, and they got it from one of the national chains here in town on their insurance. And the medication was actually over $1,000 for them out of pocket.
Jeez.
But the reality is on our membership program, it's on the cost plus model, it's less than 100. I mean, it depends on the strength people get. It depends on the quantity. But all I can say is don't assume your insurance price is the best price. We're not, maybe I'm remiss because we didn't talk about this. I think you and I take this for granted. But just because a medication is a generic medication, forgive me, it doesn't mean it's crap, okay? I mean, I know that there was a time in this country where the brand name medication was the best and the generic was second best. The generic medications in this country are regulated by the FDA. They have to be equivalent in many different ways to the brand name medication. What you get with a generic medication is you get the same drug in the same strength and the same dosage form, but you don't end up paying for all the marketing and the research and development and all the bells and whistles that you see on TV for these other big time brand name drugs, because the patent has expired on the drug. And when the patent expires on the drug, other independent manufacturers can make the same medication, submit it to the FDA for evaluation for approval, and then offer it in the marketplace. So the drugs that patients can save the most money on our membership program are medications that are the most commonly used ones because dozens of manufacturers make them. So therefore, they're very competitive in the marketplace because there's more than one source to buy them from. And that's really how the generic marketplace works. It's one of those situations where you're able to get yourself a solution because there's so many manufacturers that make it. When the brand name manufacturer makes the drug, there's one source. But often with generic medications, there could be 2, 3, 4, 10, 12 sources. So that really helps a lot for patients.
So, what other services does the Medicine Center Pharmacy have available to the patients?
I didn't talk about our custom compounding services yet, but we have the ability to work with your prescriber and we can make a custom solution for you. Maybe you have a drug allergy to a color like red dye. Maybe you can't tolerate lactose. Maybe you have trouble with cornstarch or other fillers, which might be used in tablets or capsules in commercial products. So we can make a custom solution for you in that regard. We also do a lot of custom medications for patients that are, for example, pediatric patients that can't swallow tablets or might have a heart condition and they're very young. We work often with patients out of Akron Children's that have seizure disorders or heart conditions, and the little kids are less than a year or two old and they can't swallow tablets. So we can prepare a suspension for them based on their doctor's orders. We also do a lot of custom medications for patients, men and women, for hormone therapy. We can do pet meds. So, whether you've got a cat with a thyroid condition or a dog with acrolic granulomas, any of those type of things, we have compounded solutions for you to try to help your fun little furry friends. So, don't be surprised to ask if we have solutions, because sometimes we have really good resources that you may not be aware of.
Okay. How does the Medicine Center Pharmacy protect patient privacy?
We do not sell or divulge your information to anyone. So if we fill your prescription and you use your insurance company knows. If we fill your prescription on our Health Letters membership program, nobody knows but you and us. We do not sell your information for demographic stuff like some companies, like I mentioned at the beginning of the program, do. They got in trouble with the FTC. So have confidence that we have your back and we're trying to protect your privacy. It does us no benefit to upset you, the patient, or divulge things. The best thing that we can hope for is that you have a situation where we can help solve your problem and we can do it just in confidence. But occasionally, we have patients that are kind enough to go on and give us really nice reviews on Google and tell us things about how we helped them. And that's really rewarding. But you know what? We're not going to sell your information. You don't have to worry about it. We've got a monthly email newsletter. Nobody has access to that but me. So I'm not going to divulge that information to anybody. We just want to be your health partner and help you on your journey to find the best medications that we can for you.
Okay. How can listeners sign up for Health Matters membership program?
So listeners can sign up right now on our website. You can go to medshoprx.com. You can click on the blue button at the top of the page that says Start Saving Now, and you can choose the membership program based on your needs. Are you looking for the bargain basement price? That's the basic plan. You can choose whether you want to do a quarterly investment or an annual investment, which will save you more money per month. You could also look at the Plus solution if you're looking for home delivery or adherence packaging. You can choose what's best for you. If you want to talk to one of our pharmacists, you can do that. You can check our prices on our website or in the pharmacy. So basically, whatever way you're most comfortable for, whether you use the internet, you pick up the phone, or you stop in the pharmacy, we can be accommodating and help you find the best solution for you.
How complex is the sign up?
Sign up is really easy. I mean, it's basically when you go to the website, it's basically your name and your email, and you pick your plan. And we probably have more work to do on the pharmacy side than you do to sign up, because once we enroll you in the program, then what we do is we go into the pharmacy system and we put your name and info in there and make sure you're set up for the best pricing. And, I failed to mention, forgive me, but in addition to preferred generic pricing, patients also get a 10% discount on everything we have in the front end of the pharmacy. So you can get discounts on your Tylenols or your Motrins or even your Kleenex boxes. So there's a lot of different ways the membership program provides rewards and advantages to get the best value out of the program.
Okay. What do you want our listeners to take away from today's show?
Today, I just want you guys to realize that insurance price isn't always the best price. Whether you have a Medicare Part D program, whether you have a commercial insurance through your employer, or maybe at this point you don't have insurance, but you need to ask questions of your pharmacy and pharmacist. And, I hope that we can be an asset to you in the community. It's one of those things that we continue to try to differentiate ourselves from what's out there. When you call our pharmacies, you're going to get someone on the phone really quick. You're not going to be stuck on hold for 10 or 20 minutes. When you walk into the pharmacy, you're not going to have to wait in a long line and wait for half an hour to talk to a pharmacist. We're accessible and available, and we want to help you save money with our Health Matters membership program. And I think the best way to do that is just talk to us, and we'll help you find a path.
Okay, we are out of time. Thanks, Brad, for sharing the details of the Health Matters membership savings program. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health Systems and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.